My name is Adam Schmitt. I'm a board-certified dermatologist and fellowship-trained Mohs surgeon here at Zell Skin and Laser. Skin cancer can occur technically anywhere where you have skin. Certainly they're most common where people have had burns, where they've had a lot of sun exposure, but we find skin cancer all over on the body. So there are several risk factors for skin cancer. Certainly the one that is most well studied and well defined is UV exposure. So that can come in the form of sunlight, certainly being the most common, but obviously using tanning beds is a well-known risk factor as well. Both major kinds of UV exposure are risk factors, so there's UVA and UVB. UVA we think suppresses the immune system a little bit, and UVB is what ends up causing the specific mutations that end up becoming the skin cancer. People who are fair-skinned tend to be at the highest risk for skin cancer, but any ethnicity can develop skin cancer. People who typically only burn, they never ever develop a tan, or rarely develop a tan, are at the highest risk of developing skin cancer. The more easily you burn and the more burns you've had increases your risk of skin cancer. Smoking in general is obviously bad for your health, but specifically it increases your risk of skin cancer as well. And then we know that people whose immune systems are suppressed, either from an internal disease or disorder, or if they've had something like a transplant or certain conditions where a doctor wants to or needs to suppress their immune system, those will also increase the risk of skin cancer. We have different recommendations for when people should get checked for skin cancer. So certainly if people have had a history of skin cancer, we want to see them very regularly. Sometimes, depending on what type of skin cancer they've had, it's as infrequently as once a year. But if they've been diagnosed more recently, or if they've had more aggressive forms of skin cancer, we sometimes want to see them every 3 to 6 months. For people who don't have a personal history of skin cancer and they don't have any first-degree relatives with a history of skin cancer, the recommendations are a little murkier. A lot of that depends on our assessment of their risk for developing skin cancer. So if they are immunosuppressed, like we talked about, if they have a history of a lot of burns or a lot of tanning bed use, if they have a lot of moles, oftentimes we'll want to see them sometimes every 6 months and at least every year. There are some pretty easy to spot warning signs for the most common types of skin cancer. So the most common type of skin cancer and the most common type of cancer, period, is called basal cell carcinoma. About 70 to 80% of those occur on the head and neck, so it's a fairly easy area to monitor. And what you're looking for with those are typically these pink papules or pink scaly areas that continuously grow. And people often describe spots that just don't heal. They thought it was a pimple or a ruptured hair follicle or something really bland at one point. But after weeks and months, it just kind of never heals. Those are concerning signs for a skin cancer. Basal cell carcinomas also tend to bleed very easily, so with minimal trauma, no picking, no scratching, anything, just kind of towel off after a shower and it starts bleeding. Those would be signs specifically for a basal cell carcinoma. Tends to have a very, very good survival outcome. They very rarely metastasize or go to other parts of the body. That typically only happens if they're allowed to grow for several years or even decades. Squamous cell carcinoma, the second most common type of skin cancer, those tend to be really scaly and they tend to be painful or tender. Patients oftentimes, if it's on the ear, they'll say, I roll over in bed and I feel a pain. That's usually pretty telling for a squamous cell carcinoma. Squamous cell carcinoma has a tendency to be a little bit more aggressive. Again, the vast majority are easily treated, especially if they're caught early. Around 5% or a little bit less than 5% will spread to other parts of the body. Again, that tends to happen if they're caught later, if they're allowed to grow for a long period of time, or if a person has other high-risk factors. And then for melanoma, we tend to talk about the ABCDEs of melanoma. A stands for asymmetry, or one half completely different than the other. B is for irregular border, so instead of being nice and uniform and round, it's got sort of jagged or rugged edges. C is for color variation, so again, instead of being nice and uniform brown or even a little bit of light brown, a little bit of dark brown, it's got multiple different colors within it. D is for diameter greater than 6 millimeters or the head of a pencil eraser. And E is for evolving or changing over time. It's important to know that the majority of melanomas actually arise out of brand new moles, but when we're talking about existing moles that have become cancerous, these are the features that we're looking for. In general terms, anything that's growing continuously, bleeding on its own, painful, or changing in size, shape, or color is worth investigating. Well over 95% are very easily treated, again, with a surgical technique. It's called a wide local excision. Typically, you can just cut it out and you're done with it. If we have any concern for a skin cancer, it's very easy for us to sample it and get an answer quickly. And so if you have any question about a spot that's growing or changing, whatever the situation may be, track down a dermatologist, somebody who is used to looking at skin all day long and feels comfortable looking at different lesions on the skin. And if there's any concern, they'll get a sample of it and get you an answer very quickly.